Hello friends, welcome to another video and assalamu alaikum to everyone. So our today's video topic is malignant pleural 2023. So let's start. Malignant pleural effusion MPE in the short form then denotes an advanced malignant disease process. Most of the MPE are metastatic involvement of the pleura from primary malignancy at lung, breast, and other body sites apart from lymphoma lymphomas. The diagnosis of MPE has been traditionally made on cytological examination of pleural fluid and or histological examination of pleural biopsy tissues. That still remains the initial approach in these cases. There are been tremendous advancement in the diagnosis of MPE nowadays with techniques example characteristic ultrasound and the compound tomography features imaging guided biopsies, fluorescence, postural emission, immunocytochemical analysis, etc., that have made possible an early diagnosis of MPE. The various modalities with better tolerance, such as pylorisis and indwelling pleural gathers, etc., for long-term control. All the management approaches remain palliative to improve the quality of life and reduce symptoms. While choosing an appropriate management intervention, one sound consider the clinical status of the patient, life expectancy, overall cost, availability, and comparative institution outcomes, etc. Keywords: malignancy, pleural effusion, pleurodizes, thoracoscopy. Go to introduction. Malignancy is the most common magnification of the pleural involvement by advanced malignant disease occurring in the approximately half of all patients with metastatic carcinomas. About two-thirds of malignant pleural effusion are secondary to lung cancer, breast cancer, and lymphomas. Next to these sites is ovarian carcinoma, followed by the malignancies. Is in about 66% of these patients, the primary site is not identified. So, involvement of the pleura in the malignant tumor can occur directly or indirectly. The direct involvement of pleura results from the several mechanisms that includes pleural metastasis with increased permeability, pleural metastasis with absorption of pleural lymphocytes, medicinal lump node involvement, thoracic duct interruption, bronchial obstruction, peridial involvement, etc. Indirect involvement of pleura in malignancy may also result secondary to hypoproteinemia, post-productive pneumonitis, pulmonary embolism, post-therapy, etc. in these cases. Go to clinical assessments. The initial clinical assessment essentially includes an in-depth clinical history to identify possible underlying cause for the pleural effusion. Symptoms and signs may be specific to the respiratory system or non-specific one. Dyspnea is a major respiratory system in such patients and usually progressive. This is seen in up to 50% of the patients of MPE and due to several factors that includes loss of functional lung tissues secondary to the aesthetics, medicinal shift, and most importantly, reduce compliance of chest wall. Number three, chest pain is another important such infection and other conditions like pulmonary infection, and about 60% of patients having mesothelioma experience consult dull or essentially localized pleuritic chest pain compared associated Abdominal lesion or cough is another non-specific symptom. History is also useful is getting information about exposure to gas, Sjogren's, mesothelioma, and other conditions like drug included pleural effusion. Constitutional symptoms such as fever, decreased appetite, weight loss, night sweats, restriction of daily activities, although non-specific one are most often seen a previous history of malignancy at other body sites, even in the remote past, should be seriously asked in the such patients. Thank you very much for watching this video.